Good morning, everybody. Welcome to our final national webinar about the Health and Care Staffing Scotland Act. You're very welcome this morning. We're just people are just joining now, so there's a lot of pinging in our ears at the moment, but we're just admitting as we go. So you'll see from the Holden slide there that there's no access to cameras and microphones, and this is due to the expected large numbers on the call. I think we've got 260 registered for the session today. Not everyone will maybe turn up, but we'll see. But you will have access to the chat for any questions, and we'll respond to the questions in the chat. So welcome to those just joining. Hope your morning's been good, and I hope the weather where you are is nice. We were just chatting about that earlier. I'm a wee bit overcast here, just south of Perth, but the sun is trying to break through, so fingers crossed it manages it. Kind of a nice afternoon. And for those just joining, you'll see from the slide there that there's no access to cameras and microphones due to the large numbers on the call, but you will have access to the chat for any questions. So I've got 133 people at the moment, and it seems to have the pinging for people entering seems to have tailed off. So hopefully we can just go ahead and start. And there's still just a couple of people coming in. So welcome to those coming in. If you're just joining, please note that the cameras and mics have been disabled due to the numbers in the call, but there's access to the chat. And we'll do our best to answer as many questions as we can, either in the chat or at the end of the session, if we don't manage to get to them all. But if we don't manage to get them all, we'll send out a response to all those on the call. So the purpose of today's webinar is to learn about the Health and Care Staffing Scotland Act 2019 and to hear examples of what services are doing to comply with the Act. And we're going to give you some information about free resources relating to staff wellbeing. So we'll start with the guiding principles. And we'll go on and look at some staff wellbeing resources, and then we'll look at part 3 of the Act, and we have a guest speaker today, and then at the end we'll respond to any questions we haven't got to in the chat. So still just a few people coming in. Welcome if you're just coming in just now. Just please note that there's no access to cameras and mic, but you do have access to the chat. So David is on the call with us today, and he's going to put up our usual poll to ask, are you ready for the Health and Care Staffing Scotland Act's implementation on the 1st of April? So if David could put that up it should come up on your screen any second. So I don't see that. Is it coming up for people?
That's it up now, Helen.
Is that that's great, thanks. Okie dokie. So I can see that people are responding to that now. Fantastic. So for those of you who don't know, this is our Safe Staffing Programme team. We have oversight from the Chief Nurse, Marie McCary, and our programme lead is Steph Tom. Our Improvement Support Officer is David Lenny, who is organising the polls today. And we've got 6 safe staffing advisors divided into adults, children and young people, and early learning and childcare teams. So myself, Helen Honoré, and Glo McLaughlin are on the call today. Tom is not able to make it today. Supporting children and young people is we have Melissa Cook, who will be responding to questions in the chat today. And from early learning and childcare, we've also got Candice Aiken, who's also helping out in the background with the chat, and Joanne Duncan isn't able to be here today. So there are 4 parts to the Act. Part 1, the guiding principles, and Part 3, staffing and care services are relevant to social care. Part 2 is only for NHS and it's very lengthy. Part 4 is the general provisions, which give powers to the Scottish ministers around enactment of the legislation and to make amendments as necessary. So once the new legislation is enacted on the 1st of April this year, the current legislation about staffing, Regulation 15, will be revoked. So we've got 24 days left of the current legislation before it's replaced by the new Act. It's nice to say that, actually. I've been used to saying it's for so many years and so many months, and it's nice to finally get a countdown to days. So the first part of the Act tells us about the guiding principles, and these apply to all social care services registered with the Care Inspectorate, every local authority and every integration authority that plans and secures services. So subsection 1A states that the main purposes of staffing for health and care services are to provide safe and high quality services and ensure the best care outcomes for people who use services. I'm sure you'll agree that those are worthy aims. So the guiding principles are outlined in these 8 headings, and these must be considered when arranging staffing in any service type. So these principles matter only insofar as is consistent with the main purposes. So most of these headings are similar to the expectations already set out in the current legislation. So the health and social care standards support the first principle of improving standards and outcomes for people experiencing care, and you'll be very familiar with them. The second principle of taking account of individual needs is something that many services do well through assessment, care planning and review. And there's a wide range of good practice guidance, the Care Inspectorate quality frameworks, self-evaluation, scrutiny and quality improvement work that supports all of these principles. We've had requests to hear more voices from the sector and have collected information from our various events over the last year. And we've made word clouds to show you what services are doing to achieve each guiding principles, and we'll publish these on our hub page. But we'll take a look at 3 of the word clouds next. So being open with staff and people experiencing care about decision making. You can see that team meetings, emails and social media are the most popular way of communicating decision making about staffing, followed closely by supervision, care reviews and newsletters. And the aim is that decisions on staffing are openly communicated. You'll use a variety of communication channels depending on people's needs and preferences. And you're aiming for a transparent culture which opens the service to new ways to overcome risks as people feel comfortable approaching the service. And you'll be aiming to involve people using services in the recruitment process as well. Just move on to promoting multidisciplinary services as appropriate. So you can see on the word cloud that supportive relationships are important, as well as MDT meetings, care reviews, and that visiting professionals have ease of access. And the aim of this principle is that each unique professional role is recognised and promoted to bring about high quality services and the best outcomes for people. And that people using services when required should be assessed by an appropriate qualified person. And I'm aware that depending on where you're situated, it may not be easy to access some services, in which case we would recommend that you record your attempts to contact professionals and any escalations that you make. And feedback from other professionals informs the decision-making process. So think about avenues you have for professionals to feedback to you. You might rely on verbal feedback on the day of a visit, which is fine if this works for you. But you could also consider if there are any missed opportunities for feedback and think about how you might gather these views. Ensuring the well-being of staff is the next one we'll look at. So this is new to this legislation. It's not in the current legislation, so it's nice to see that. I think there's been a lot happen during the pandemic with regards to enhancing staff's well-being, and services are doing a lot of amazing stuff. But again, supervision and meetings were the most popular way of monitoring staff well-being, but you can see the creativity and variety of what services are already doing that complies with this principle. So the aim of this principle is that there's a focus on staff wellbeing improves outcomes for people using service. So increased wellbeing of staff, as you know, can reduce sickness absence, burnout and work-related stress, meaning that staff are available to care for people using services. Healthy, engaged and well-supported staff are also better able to provide safe and high-quality services. You're also looking to ensure that appropriate measures and checks are in place to achieve the well-being of those working in the service, for example, lone working or night working, which can increase risks to staff's well-being. And thinking about a culture of continuous improvement, the statutory guidance accompanying the Act talks about an environment where staff feel able to raise issues about the safety of people using services, like mistakes or areas of concern, and that this is vital to staff's well-being. And this involves creating a culture of transparency, continuous improvement and open communication, and an environment where it's clear to staff that there is a culture of system improvement rather than blaming individuals, for example. The staff need to feel safe to raise concerns at all times regarding any risks resulting from staffing. Your service may be doing well with regards to this, but it's good to check in every now and then and ask yourself, how do you know that all staff feel safe to raise issues or make suggestions, and not just the staff who are naturally more confident? So what processes do you have in place to hear the quieter voices? And if these processes are not being used, it's worth finding out why not. Might be that everything's okay, but maybe not. It's just worth checking in. So I'd like to draw your attention to an initiative that Perth and Kinross Council rolled out. They organised sessions for health and social care staff around P&K in collaboration with Tommy Whitelaw from the Alliance. So these sessions take the What Matters to You concept widely used in healthcare for patients and ask staff the same question. So they describe a What Matters to You approach as creating respect, innovation and kindness, which influences our joy in work and in turn makes a difference to the lives of the people we serve. So this work ties in nicely with the staff wellbeing guiding principle, as does the work of Able Futures, who offer mental health support for people at work. You can apply online for 9 months free advice and guidance from a mental health specialist, and their web address is on the slide there. Another organisation doing exciting work that benefits staff wellbeing is CME Scotland. So CME's national programme to end mental health stigma and discrimination introduces mental health stigma as a barrier to staff wellbeing. They discuss what care services as employers can do to create mental health inclusive workplaces, free from stigma and discrimination, and signpost to free support, tools and resources to reduce stigma at work. So the image you can see on the slide is taken from their webpage, which includes CME in Work, and there's lots of downloadable resources there. But we're now going to play a video of the presentation that Vicky from CME gave at our webinar on the 18th of January. So if you bear with me a wee second, I have to include the computer sound. That would help. Okay.
Hi, Helen. I don't think the video is playing. I don't think anyone can see or see the video.
Hi. Yeah, I was just seeing that in the chat. Oh, has a press. So I think some people are seeing it and hearing it. Can you let us know? Oh, someone pressed play. Okay. So if you all press play, you'll be watching it at different times. Dear, I don't know what's gone wrong because I've included the computer sound, so I can try again. Take it back and try again. And if those who press play could sync to, I don't know what's going on. So now I'm pressing play and nothing is happening. I'm sorry about this, folks. If you just give me a wee second, I'll see if I can go back and try again. So I'm so sorry. Some people were having experiencing technical difficulties and weren't able to either see the video or hear the video, or for some people it got stuck on one slide. And I don't have a solution. I did everything that I know to do to try to get it to work for you. So apologies for that, but it will be available on our hub page for you, and you can watch it then. Okay, so we're going to move on, and I'm going to hand over to Glo, who's going to take you through the next few slides.
Hi, everyone. We just wanted to make sure that you were aware of the staffing method framework, which you can access if you log on to our website or you visit the Safe Staffing Hub page. But I need to point out straight away that this is not planned to be used in every service type at this time. There is a caveat in the legislation in Part 4 that Scottish ministers may introduce a staffing method framework into other sectors in the future. However, this would of course need to go through the rigorous consultation processes that we've undertaken for the current one. Scottish Government asked the Care Inspectorate to specifically design a staffing method framework firstly and only for adult care homes. And this has been created in response to Section 3A of the Act. Version 6 is being piloted right now, and it will conclude this week. This considers elements around staffing that supplements a dependency tool when determining staffing levels. So it's important that providers and services don't panic if they see this discussed in relation to the new legislation and think it automatically relates to them. It sets out a framework or processes that can be followed by a registered care service provider to determine what appropriate staffing is in any particular service and setting. Following the development of a staffing method and its recommendation to Scottish ministers, the Scottish ministers may make regulations to require service providers to use that method in the future. But from the 1st of April, the staffing method framework in its current form for adult care homes, and that's adult and older people care homes, will become guidance. And I'm delighted that we've got a guest speaker with us today from the pilot project, and we've got Helen Kennard with us, and Helen's agreed to share some of her experiences in getting familiar with the staffing method framework and overlaying that in her own service where she delivers a care home service. So I'm going to hand over to Helen, because we've always said as a team that we knew that the experts around staffing was absolutely the people that are registered and delivering these services. So I'm going to hand you over to Helen, who's going to just give you some of her thoughts about having used the staffing method framework. Over to you, Helen.
Hi, everybody. We just go to the next slide. We agreed to be part of the pilot because we wanted to ensure that we were fully informed and updated around the requirements for the pilot. And through the process of being part of the pilot, I've highlighted some areas in which we think, we have continued to use our own documentation, our own quality assurance system, but incorporated it into the pilot to ensure that we've got the evidence to show when it's needed for the staffing tool. So Roselea Court currently uses a resident dependency assessment tool, and we report that across 28 days. It identifies our circumstances at care home level, it identifies where our need is, it identifies where our dependencies for our residents are, and that enables us to identify where our skill mix and staffing levels need to be. It ensures that our staffing then get good support and they get good personal outcomes for the individuals within the care home. The dependency tool allows us to then analyse what we are delivering on, what the care need requirement is, and it supports the staffing hours required to meet this need. Incorporates the layout of the building, obviously, because whether you have a small home, a large home, a medium build home, the layout of the building is always going to be an identity requirement for making sure that your staffing levels are clear. So we looked at it from all aspects there. It also supports us to flex our staff where it's needed to support end-of-life care, stress and distress presentation, anything else that transpires in relation to individual support. The new staffing method framework supports us to evidence through our own numerical rotas and continuous assessment of the resident need. Our rotas are scheduled in advance, a minimum of 4 weeks, which allows us to identify the skill mix ongoing through our 28-day resident dependency tool. It allows us to then develop and introduce further support if it's required. It lets us add in any inductions for new staff, which supports the evidence for the new staffing framework. We evidence through our training platform, our knowledge, our competency, and our supervision documentation. All of that is incorporated within that evidence for the staffing tool. We gain feedback for the staff on shift times, whether they meet the need. We speak to them, we ask them, is there particular times within the care home that we need extra staff on, times where we can maybe flex that capability, so we make sure that we're meeting the needs and the wishes of the residents. It also allows us, if we've got increasing care for end-of-life care or anybody that's presenting with stress and distress, that we can identify that and we can flex our staffing to support that. We also have a quality assurance system in place. Our quality assurance system composes of 27 different audits. This supports our abilities to evaluate and support where there might be challenges that arise. That could be staffing, skill mix, care needs requirements. Perhaps it's around equipment in particular areas. Do we need to develop that? Is there anything else that we need to add in? So because of these audits and the audit system that's in place, it allows us to identify shortfall and any actions that we need to improve. And improving on the actions, we also complete PDSAs, Plan, Do, Study, Act tools, and we get this with colleague input. We make sure that this identifies any requirement for change. We understand where we need to change. We then look at what we need as far as systems, equipment required to support that change, what the timescales may or may not be, and how we're going to evidence that change. We also have champions in-house, which support us then to update, providing training, updates for new staff, updates on new legislation, and anything else like bite-sized training that the staff may or may not require. The audit system evidences that we've got robust governance arrangements that focus on the delivery of person-centred care and supports us to keep people safe, ensuring that our staffing levels are correct where the need is. We promote a positive culture of continuous improvement, providing our safe systems of work, ensuring standards reflect our best practice. That generally comes through our supervision process, our performance and development support. We support staff to discuss where they want their own performance to be, where they want to be developed in their own areas, and we identify with them what timescales they may need to support us and how we can access that, whether that be internal or whether that be external. We get feedback from our staff. We do daily meetings, we do weekly clinical risks, we do monthly senior meetings, and we do feedback at staff meetings. We also do multidisciplinary team meetings. We work very closely with our chart team to make sure that they are incorporating any issues that we require. So that helps us to evidence where we are as far as the staffing tool is concerned, but also where we are as far as continuous improvement is concerned. This can be clearly evidenced to provide the necessary considerations for the new staffing tool. It's not hard, it's not difficult. Everybody probably does it. Everybody probably already has it in their care homes, but it just means that you've got that capability to incorporate it through and evidence where it is. It doesn't mean changing your systems. It doesn't mean adding new systems into play. It just means using your own systems and incorporating that forward. Because we've been sorry, move the slide, sorry. I meant to say that to you last time and I forgot, my apologies. Because we've been part of the new staffing framework, this has allowed us to refocus our own systems, look at our current quality assurance systems, our dependency analysis, and it's allowed us to review that and evidence that we can provide the necessary evidence and the examples that are needed to meet that framework. It also provided us with a further focus. It meant that we looked at what we already had and we further developed that, so we didn't need to create any new tools, but it helped us to focus on our current tools so that we can make the evidence that we have clearer for when the care inspectorate come in or when we need to provide evidence for where we are. Going forward, we hope to speak to the staff. We'll continue to speak to the staff. We'll gain their knowledge. We'll gain their information. We'll speak to them to see whether things are right or wrong. We'll also speak to residents and relatives, and that will further support us to manage the change and ensure that the staff continue to remain positive and feel included in the decision making around us. It is daunting, it is fearful when you look at it initially, but it's certainly not an issue when you start to implement it.
Lovely, thank you, Helen. And certainly we want to thank Helen and her team at Rosslea for being part of the pilot and volunteering along with another 20 homes at the moment across Scotland of different types, sizes and location. But the time and effort that the team have dedicated over these past few months has certainly been integral to the overall testing process, which is now into years. But also she's had to complete multiple questionnaires, which will help inform our final version 7. And when that's completed and presented to Scottish ministers, it will be published in an app, which will make it easy for services to access it and for staff to be able to have it close to hand, but also in desktop format. So there's a choice there. And that will be available on the hub as soon as we have it. And I know Helen mentioned a tool that she's using within her own service, and there's a range of tools that are out there when we did some of the initial benchmarking, and around 80% of services are using a tool. Not everyone uses a tool, and you'll see when you look at the staffing method framework that in that wheel of the different components, we have made sure that a staffing method tool is weighted in the same way as any of the other important components, like involving staff, involving relatives and residents, and making sure staff voices are heard. So we've weighted that equally because the work around a possible staffing tool for social care is still at an early stage, and it may be as we go through the next 2 years it could take to develop a tool for social care, but that's certainly some of the work that we're going to be looking at as we go forward. So thanks again, Helen. That was wonderful to hear from somebody that's actually using it and reassuring that you're finding a lot of your processes and systems actually align quite nicely with the framework. Thank you.
Yeah, thanks, Helen, and thanks for being brave enough to step up. I know it's not easy, especially when there's a lot of people on the call. Well done. So another service who took part in the pilot came up with this document. It's from a small residential service who kindly agreed to allow us to show you what they worked on during the care home pilot about the staffing method framework. So the service wanted something that pulls together in one place decisions that they've taken about staff and any impact this has had on people living in the service. I appreciate you might not be able to read everything on the slide, but I wanted to show you the full document and I'll talk you through it just really to see that it's just a one page. So the top of the form identifies the minimum levels for care staffing that they work with, then lists the supernumerary hours and non-care staffing levels. The boxes in blue outline days there were vacancies in occupancy, dependency levels, if minimum staffing was achieved, and whether quality audits are current. Underneath that, there's a straightforward date, event, action taken and outcome columns. So from the last two examples that they've given, there was an admission of a new resident. So the service arranged that the key worker who did the assessment was on duty with some supernumerary time, and the outcome for the person was that they felt comfortable, I guess, and welcomed by a familiar member of staff who was knowledgeable of their needs. And then there was a senior carer who was moving from day to night shift working, and so they were given supernumerary hours given for orientation by the existing night senior, and the outcome for people would be that was effective continuity of care. But another example might be maybe you've got a staff member was scheduled to accompany a resident on an outing, but became unwell and wasn't able to work. So the action taken could be something like that you phoned bank and agency staff, but no one was available, and the outing was rescheduled for later that week. The outcome for the person would be that they were disappointed they were not able to go on their outing, but was looking forward to the rescheduled outing. So you've said what, you know, the outcome for the person then and what you've done about it. So, and we quite liked this. It's a nice, neat way of summarising actions and outcomes for people. So I'm going to hand back to Glo, who will take you through the remainder of the presentation.
Thanks, Helen. So we're on the home run. We've just got a few more slides to go through. So Helen had taken you through part 1 of the Act about the main purposes and the guiding principles. And in this section, we're going to look at the key things in part 3. And you can see here, this is where we find the duties. And we're in part 3, section 7, subsection 1. And it states suitably qualified and competent individuals must be in such numbers as to, and we're back to those guiding principles that we find in part 1, the health and well-being of people and their outcomes and the provision of safe, high-quality care. And again, that new guiding principle, and insofar as it affects either of those two matters above, the well-being of staff. So this kind of pulls that all together. The new legislation, again in section 7, does not impose specific staffing levels. So when determining what constitutes appropriate staffing levels, section 7 in part 3 of the Act tells us that care services must consider, and you'll have heard Helen from Rosalie Court talking about the nature of the service, the size, your own aims and objectives, the layout, the number of people that use it, and the particular needs of those people. And you are the experts of this. And you know that if you're undertaking wellbeing checks and prompting people who are generally independent and mobile, it's likely that you will need different staff numbers and skills and expertise than for people who are more complex, who may use a wheelchair or are confined to bed and need the assistance of one or more people for transfers. So you, again, will be the experts around managing this. So in Part 3, Section 8, again, we found the information about skills and training. Section 8 of the Act states that any person who provides a care service must ensure that individuals working in that care service receive appropriate training for the work they are to perform and suitable assistance and time off work for obtaining further qualifications appropriate to that work. There is a learning resource on TURAS platform. This is the Knowledge Skills Framework for Health and Care Staffing in Scotland. It has various levels. Level 1 is informed, and this is similar to the Promoting Excellence framework. It's suitable for all staff, and it's 4 short videos, and it provides a foundation level of knowledge around the legislative requirements, workload and workforce planning. Level 2 Skilled is aimed at team leaders, and that's a suite of 4 modules, a bit more in-depth, looking at the requirements, and it delivers a clear, applicable understanding of workload and workforce planning methodology. And by virtue of role and levels of responsibility, team leaders will, of course, be able to inform, support and encourage team members with workload planning. However, feedback has been that to date these modules are considered to be quite clinical, quite NHS focused and difficult to navigate. Staff have to go through all the NHS sections before they actually get to the parts of the resource that might be applicable to them. The enhanced level aimed at managers is now available, and work is continuing by Health Improvement Scotland to improve all of these resources with the input that has been made available recently from the sector, and the expert level is not yet released. And you may be aware that linking to this, questions were included in our annual return about the knowledge and skills framework for health and care. However, this resource, because it is delayed and not yet complete, and the annual questions which were included to collect baseline information about the usefulness of this resource have caused a bit of confusion for people. But we're clearly telling you the Care Inspectorate has no expectation at this time that staff will have completed or need to complete the knowledge skills framework resources. It is not mandatory. However, as providers, you can evidence other training on the Health and Care Safe Staffing Act with, for example, attendance at today's event and our regional events, and also accessing the resources and the information that we've got on our hub, along with posters that you can print out and put up to raise awareness within your own services. So it's not mandatory. We were just keen to find out if anyone was accessing them. An additional learning resource has been developed in collaboration between the ACT implementation team at Scottish Government, Nurse Education Scotland, Healthcare Improvement Scotland and the Care Inspectorate. And it builds on some of the information that was shared in statutory guidance webinars earlier in the year and provides an easy to use accessible resource for people to learn about the guiding principles and the duties within the Act. So you can navigate through this much easier to the relevant learning resources, and again accesses different websites and links. So you'll find that useful, and I think some of our colleagues are going to put a link to that in the chat as well. So some of the other duties, Scottish ministers had a duty to consult with stakeholders prior to issuing any guidance related to the duties within the Act. And that's got to include relevant reviews, reports and information that might impact on that. And the Act also states that Scottish ministers must compile an annually published report setting out a summary on how duties being undertaken by those who provide, plan and secure care services. They must report on the effect that staffing levels in care services are having on the ability to complete and comply with these duties. And they must also list what steps they're taking to support staffing levels in the sector in order to assist people to comply with the Act. How these matters will be taken into account in determining the future supply of registered nurses, medical practitioners, social care support workers and other professionals will hopefully flow out of this annual reporting in a way that we currently don't see. And of course, the ministers will have to say something about how they ensure funding is going to be available to any person who provides a care services to assist them to comply with their duties of this Act. The first report will be to the financial year of April 24 to March 25. So we would expect to see that first report around April 25. And this is quite important because it does tie together lots of the challenges we have around recruitment and finance and future planning. And hopefully that will make a difference to services that are planned in the future. This next slide talks about our local and integrated authorities, that when they're planning or securing the provision of a service from another person under a contract or agreement, that they must have regard to these guiding principles. They must take on board any guidance that's issued by ministers, and they must be aware of the duties relating to staffing for care providers, and they must also create and publish reports on an annual basis around those compliance risks that they're made aware of. And there's been some testing. We've worked with some partnerships to test the template that Scottish Government want them to use when publishing information for the annual report. And it's a fairly simple template that asks 2 questions about detailing the steps they have taken to comply with the requirements of Part 3 and identify any ongoing risks. So partnerships can use existing resources like Care Inspection reports, strategic inspection reports, the Care Inspectorate database, and this gives them some information. But of course, you'll know some services are inspected annually and some will have a shorter inspection, and we won't always look at staffing in the services that we inspect. We encourage the partnerships to consider what information they might take from their own quality assurance processes. And although Scottish Government want the partnerships to use the same template to report on every year, the Act doesn't say how they need to gather that information. So what that means for you is that there may be some local variation in how that information is collected if you work across a number of health and social care partnerships. The testing with the partnerships was completed and it indicated that the partnerships are prepared for the Act. And whilst there will need to be some assurance that providers comply with the Health and Care Safe Staffing Act, there is absolute consensus that this should be achieved without increasing the burden on reporting on service providers. So again, that was very encouraging to hear that they're aware of the level of reporting that you currently do, and they're taking that on board. So some of the things they'll do going forward, we'll have some discussions and workshops locally. They'll look at training, they'll review their processes, their own contract monitoring framework and terms and conditions that they might publish in any future tenders. And again, they'll review the quality assurance processes that they've already got with you. So how will the Care Inspectorate monitor compliance going forward? And again, there's nothing new here. Registration, there's some changes around registration so that it links to this new legislation. Annual returns, we've talked about the changes that we've put in around the knowledge skills frameworks, and that will adjust over the years as we get more information and we know which information is going to give us the data that we need to look at. We've got the health and social care standards, which you're all familiar with. You'll understand the methodology and the frameworks that we have and our key lines of inquiry. We're doing some work around core assurances, and we'll continue to use complaints and notifications and that intelligence that we get from other activities. So on Monday, the 1st of April, Regulation 15 that we currently use, which is SSI 210, this is where the requirements for care services currently state that you've got to have competent staff and you've got to ensure that they're trained appropriately, and that will be repealed. And on the 1st of April, it will be replaced by Section 7 and 8 of the Health and Care Staffing Scotland Act that we've just gone over. And that will apply to all registered care services in adult, ELC and CYP sectors. So this is the area of the new legislation that we would use if we were going to make any areas for improvement or make any requirements. So we're almost at the end, and David's just going to put in the same poll that you did at the beginning, and we're just going to ask you to redo that poll just to get a sense of whether you're feeling any more confident about the implementation of the Act. And we'll just wait to see if David, it's unlikely I'm able to see that, so I'm going to be dependent on someone to let me know that that's on your screen. Yep, there it is. So if you can just complete that again. And it certainly looks like quite a number of people are feeling certainly more ready and a bit more informed than they did initially.
I'm aware of the time, Glo. We're just 1 minute over time. So.
We're just at these last few slides, and we're just to let you know that this concludes the national webinar series that we've been running. We will ensure that you've continued access to these recordings and the learning resources on the hub. And if you can make it, we've just got one more face-to-face event, which we're doing next week in Oban. And we're hoping that those folk from that area will be able to join us. And the last slide is just a link to the evaluation for the webinar itself, and someone will put a wee link in the chat as well. And again, you've got links to the Safe Staffing Project, our hub, and you can join our mailing list as well. And we will certainly keep you updated. What we will be doing over the next few weeks is concluding the pilot. We've got our annual report to do, and we will have recommendations to make to Scottish ministers. So we're going to be focusing on drawing this year's objectives to a close. We have funding for next year, and we anticipate as soon as we know what the objectives are that we'll let you know, but it certainly will include continuing with the staffing method framework and looking at the sector around the need for or the desire for a particular staffing tool. And that's me finished. Helen, I'll hand back to yourself to close.
Thanks, Chloe. That's great. Apologies for running over a couple of minutes. I think the video playing up made that happen. I know there's some comments in the chat, but that we've maybe not got to. I know someone was saying that they're less than confident that Scottish ministers will meet their duty. I appreciate why you think that, and you know, I think it's a case of wait and see. It is the first time though that this is in primary legislation that they need to have this report, so it's going to be a case of wait and see. And so the first report in April 25 will give us an indication, I guess, of what they're going to be saying to that effect. But unfortunately, we don't have time to get to the questions. But what we'll do is maybe, I know someone said they maybe want to have an offline discussion about something just to clarify a point. So we can do that. We can get in touch. Or if you want to contact us on our Safe Staffing project at kinspectorate.gov.scot to clarify anything, that's fine. We can do that. So thank you so much for your time and attention today. Apologies again for the technical difficulties, and I see that some people, just a couple of people, weren't able to access the chat for some reason. I've absolutely no idea why that happened. It's, you know, everyone should be able to get into the chat, so I don't know what's gone wrong there, so apologies for that. But if you want to get in touch with us at that email address on the screen there, please do so. So thanks folks, take care, and I hope you have a good afternoon.